Hello everyone, this is Dr. Win Tran from VitMD.net. Today I will talk about how to present a case using SNAPPS. This is a 6-step learner-centered approach to clinical education, and we're utilizing this method a lot in the US to teach resident and medical students. So what are SNAPPS? So SNAPPS stands for summarize briefly the history and the findings, and narrow the differential to 2 or 3 possibilities. A. Analyze the different comparing and contrasting the possibilities. And P. Probe the preceptor. You ask the teachers a question about uncertainties, difficulties. And other P's mean planning management. What do you like to do with this case? And S, select a case related issue for self-directed learning. Alright, so let me give you some example of SNAPPS. Mrs. Win is 66 years old, a female with a 3-month history of brain knee pain and intermittent swollen occurs whenever she walking exercise. She have no other joint effective. She deny any current or previous problem with her knee. No recent travel, no injury. Daily ibuprofen provides some help. So this is a snap, like summarize the history and the finding for a elderly with a brain knee pain. So now we move to N. Given the length of the symptom, my differential diagnosis include osteoarthritis or other joint arthritis like gout or rheumatoid arthritis. Well, now you analyze. So A, I think osteoarthritis is the highest on my differential diagnosis given the age of this patient. Mrs. Win is 60 years or something, ladies, and also the activity worsening her pain, and she have no mention on little or no mention on morning stiffness. So injury is low on the differential because she have no injuries. So you go to P. So S, N, A, or S, P. You ask, you probe the preceptors. Is there anything else that you would include on your differential diagnosis for this lady with brain knee pain, Dr. Tran? So if you ask me this question, I would consider all the things I mentioned earlier, like gout or other reactive arthritis, or I ask about all the joint symptoms. So those things that you ask your receptor. So that's P. That's the first P. How about second P? Planning, manage patient. So the student or the resident will say, I would like to prescribe a prescription strength anti-inflammatory medication such as ibuprofen 600 or 800 to relieve the pain. I also advise her to do proper exercise, physical therapies, and return to evaluate her pain. So that P, and then the S, lastly, is select a case. I would like to understand the pathophysiology of osteoarthritis in elderly and to see is there what else consider an optimal treatment for this particular patient. So you basically go over the 6-step SNAPPS SNAPPS with a case of 65 years old, a Vietnamese lady present with brain knee pain. All right, thank you guys, and I hope to see you in the next videos.